gynecological problem we see it in practice. It can exist by itself and can be associated with endometriosis. It's when the lining of the womb, which is the glandine stroma, is present in the muscle of the womb. So the lining is away from its place and it's in the muscle of the womb, making the womb to be bulky and tender. And ladies usually present with pelvic pain, which is chronic usually, and also pain during periods and pain with intercourse, quite similar to endometriosis. They have also abnormal vaginal bleeding and heavy periods. And it might affect fertility as well. Yes, so it is not easy to treat adenomyosis. Slightly different to endometriosis because don't forget the lesion is in the womb itself. Of course, the gold standard for treating, first to diagnose adenomyosis, we suspect it clinically, according to what the lady tells us, chronic pelvic pain and painful periods, painful intercourse, abnormal vaginal bleeding. We examine the lady, it's a tender, bulky womb. We confirm the diagnosis by an ultrasound scan, and sometimes we need to do an MRI scan. And to treat it, the gold standard, if the lady has completed her family, is removal of the womb, hysterectomy. But of course, if you are talking about a woman in the context of trying for a baby, so fertility, the treatment, if she's trying for a baby, we cannot give her the same hormonal therapy which we explained for endometriosis, which is exactly the same. The progesterone-only pill, the Mirena coil, which has progestational coil, the Depo-Provera injection, the implant, all the and Zoladex, which is the gonadotrophin-releasing hormone analog, which stops the ovaries from working. The same medications which we offer for ladies with endometriosis, we offer for adenomyosis. But if the lady is trying for a baby, it can reduce the chances of implantation, which we said. But if the adenomyosis is quite extensive, sometimes we offer surgical treatment, surgical excision of the adenomyosis. This can be done laparoscopically and can be done openly. It is not a straightforward operation, it's not performed in all hospitals, but it can be done, and the lesion of adenomyosis will be excised, and the womb will be sutured back. There is a slight increased risk of rupture uterus, of course, if the lady is trying for a baby later on. But according to some data published, that it can improve pelvic pain and can improve fertility.